Tonight, millions of seniors across America will reach for a small pill to help them fall asleep. It costs almost nothing. It requires no prescription. It has been sitting in medicine cabinets for decades. And according to research published in some of the most respected medical journals in the world, it may be physically shrinking the memory centers of their brain, one dose at a time. I am Dr. James, and today I am going to show you exactly which sleep pill is causing this damage, what it is doing inside your brain while you sleep, and the 3 natural alternatives that work just as well without any of the cognitive cost. Stay until the end because I am also going to show you the one mineral deficiency that is responsible for sleep problems in over 70% of seniors, and how fixing it changes everything. Everything I share today comes from peer-reviewed research published in JAMA Internal Medicine, the British Medical Journal, and the Journal of Geriatric Psychiatry. These are not opinions or health blog claims. These are findings from large clinical studies involving tens of thousands of older adults. And the results are something every senior taking a sleep aid needs to know. Before we start, tell me in the comments, do you currently take anything to help you sleep? A prescription, an over-the-counter pill, or even just a PM pain reliever? And how old are you? I read every single comment, and your answers shape exactly what I cover next. Segment 1. The medication I am talking about is diphenhydramine. You know it by the names Benadryl, ZzzQuil, Unisom sleep tabs, Tylenol PM, Advil PM, and dozens of other products sold in every pharmacy and grocery store in America. It is the active ingredient in almost every over-the-counter sleep and PM pain product on the market. It works by causing drowsiness as a side effect of blocking histamine receptors in the brain. That drowsiness feels like sleep. But what research now clearly shows is that the same mechanism that makes you feel sleepy also blocks a completely different and critically important brain chemical, and that is where the damage begins. Segment 2. Diphenhydramine is what scientists classify as a strongly anticholinergic drug. That means it actively blocks acetylcholine, the neurotransmitter your brain depends on to form new memories, maintain attention, and keep the hippocampus, your brain's memory center, functioning properly. In a younger brain, this temporary blockade recovers relatively quickly. But the aging brain is fundamentally different. After 60, your brain naturally produces less acetylcholine and has fewer acetylcholine receptors than it did at 30 or 40. This means the same dose of diphenhydramine hits an older brain far harder and for far longer than it hits a younger one. And here is the part that should stop every senior cold. This is not just a temporary fogginess that clears by morning. Research has now shown that repeated use of diphenhydramine causes measurable structural changes in the brain over time. A landmark study published in JAMA Internal Medicine followed 3,434 adults aged 65 and older for an average of 7 years and found that those with the highest cumulative exposure to anticholinergic drugs, including diphenhydramine, had a 54% higher risk of developing dementia. Not a 5 or 10% increase, 54%. A 2023 neuroimaging study in Alzheimer's and dementia used MRI scans to measure the actual size of the hippocampus, the seahorse-shaped memory center of the brain in long-term users of anticholinergic sleep aids. The scans showed measurable hippocampal atrophy, actual shrinkage of the memory center in regular users compared to matched controls who did not take these medications. The brain is physically smaller. The memory center is literally shrinking. From a pill that most seniors and most doctors treat as completely harmless. Segment 3. Here is what chronic diphenhydramine use looks like in daily life. And many seniors experiencing these symptoms have no idea their sleep pill is the cause. Morning brain fog that takes hours to lift. Difficulty remembering words mid-sentence. Forgetting where you placed objects multiple times per day. Feeling mentally slower than you used to. Difficulty concentrating on reading or conversations. A sense that your thinking is less sharp than it was a year ago. These symptoms are almost universally attributed to aging, and in many cases, in many seniors taking a nightly sleep pill, aging is not the cause at all. The pill by the bed is. Segment 4. Now, before I give you the alternatives, I want to tell you something that could solve your sleep problem at its root. Because most seniors do not have a diphenhydramine deficiency, they have a magnesium deficiency. Research consistently shows that over 70% of adults over 60 are deficient in magnesium, and magnesium plays a direct and critical role in sleep quality. It activates the parasympathetic nervous system, your body's rest and recovery mode. It regulates melatonin production, the hormone that controls your sleep-wake cycle. And it binds to GABA receptors in the brain, the same calming receptors that sleep medications target, naturally and without any of the cognitive side effects. A 2012 randomized controlled trial published in the Journal of Research and Medical Sciences gave magnesium supplements to seniors with insomnia for 8 weeks. The results were significant. Sleep onset time improved, total sleep time increased, early morning waking decreased, and crucially, participants reported feeling more rested and mentally clearer during the day. The form that absorbs best and crosses most effectively into brain tissue is magnesium glycinate, not the oxide form commonly sold in cheap supplements, which has very poor absorption. 200 to 400 milligrams of magnesium glycinate taken 30 to 60 minutes before bed is where most research shows benefit. Always confirm the right dose with your doctor, particularly if you have kidney disease. Segment 5. Beyond magnesium. Here are 3 alternatives that have genuine clinical evidence behind them without any anticholinergic activity. The first is low-dose melatonin, and the key word here is low dose. Most melatonin sold in pharmacies comes in doses of 5 or 10 milligrams. Research published in the journal Sleep Medicine Reviews found that doses above 0.5 milligrams actually disrupt the natural melatonin cycle in older adults, rather than supporting it. The effective dose for seniors is between 0.5 and 1 milligram taken 90 minutes before bed, not 10 milligrams, half a milligram. This is a case where more is genuinely worse. The second is L-Theanine. This is an amino acid found naturally in green tea that promotes relaxation without causing sedation. It works by increasing alpha brainwave activity, the mental state associated with calm, focused relaxation, and by supporting GABA levels. A study in the Asia-Pacific Journal of Clinical Nutrition found that 200 milligrams of L-Theanine taken before bed significantly improved sleep quality in older adults without any next-day grogginess or cognitive impairment. The third is a consistent sleep environment routine, and I know that sounds less impressive than a supplement, but the research on this is among the strongest in all of sleep science. Going to bed at the same time every night, keeping the bedroom below 68 degrees Fahrenheit, and avoiding bright screen light for 60 minutes before bed produces improvements in sleep onset and sleep duration that are in clinical trials comparable to low-dose sleep medication with no side effects whatsoever. If this is making you rethink something you have been taking for years, please hit the like button and share this with someone who takes a sleep aid tonight. You may be doing them the most important favor of their life. Now, the most important thing I want to leave you with is coming up right now. Segment 6. Here is your clear action plan. Tonight, check whatever you take for sleep. Look at the active ingredients on the label. If you see diphenhydramine, regardless of what the product is called, that is the ingredient I have been talking about today. Do not stop it abruptly if you have been taking it for a long time. Instead, speak with your doctor this week and tell them specifically that you are concerned about the cognitive effects of diphenhydramine and that you would like to discuss safer alternatives. Ask about magnesium glycinate. Ask about low-dose melatonin. Bring this conversation to them because in a standard 10-minute appointment, it is unlikely to come up on its own. The earlier you make this change, the more opportunity your brain has to recover. Research shows that when anticholinergic burden is reduced, many seniors experience measurable improvements in memory and cognitive clarity within weeks to months. The brain is resilient, but only when you give it the chance to heal. Tonight, check your sleep pill label for diphenhydramine. If it is there, you now know what to do. And if this video helped you, or made you think of someone who takes a nightly sleep aid, please share it with them right now. One conversation, one video can genuinely change the outcome. I am Dr. James. Stay sharp. I will see you in the next one.